Hi, and welcome to DTV. I'm Gloria Johnson, State Representative for House District 13, and I'm here today with Todd Shelton. He's a volunteer with Tennessee Healthcare Campaign. I've known Todd for quite some time. One of the really neat things he does is help to sign people up for the ACA. He does a volunteer with that. So, Todd, just tell us a little bit about what you do with Tennessee Healthcare Campaign.
Well, like I said, it turns out we've got the enrollment period getting ready to start the 1st of November for folks that already have an account with the Affordable Care Act and need to renew it or change it. That'll go on for only a month and a half.
Wow.
Yeah, used to go all the way through January, and the current administration cut us back a little bit, so we go to the 15th of December. But there'll be different sites around. It'll start at Mount Calvary Baptist Church, and on the 1st, that'll be the big first day, and then there'll be schedules posted on the mayor's website and stuff showing the locations. We have a location in South Knoxville where I live at the community center there, and we have people there who are very knowledgeable about signing people up and helping them with their questions, and people come in, it's free, and we'll do it until the 15th of December. And so
Great. Well, I appreciate it, because I know I just got a phone call the other day from a friend who had a friend who needed to sign up, had lost their insurance, and so wanted to sign up, and they wanted some help. And I don't know if they called you or not, but I gave your number and Rich's number, so
Good.
in case sometimes people need help with that initial sign up. So we really appreciate the work that they've done, and I've worked with Tennessee Healthcare Campaign for a while, and you guys are just always there to help, and I appreciate that.
Well, we appreciate your vote for it whenever it comes up, and healthcare is talked about at the state legislature.
Absolutely.
We're glad you're there.
And that's one of the things we're going to talk about today. We want to talk about the difference of what TennCare is now and this proposal from the governor of block grants. And so we have always been working and pushing for the expansion of Medicaid, because here's what we know about the expansion of Medicaid. It will ensure 300,000 additional Tennesseans who need that care.
Right.
It will keep our rural hospitals open. Our rural hospital closures, I believe, are #1 in the country right now, and I think we have 2 at risk getting ready to close. We've got Oneida and Jellicoe that are really struggling and are likely going to close.
Yeah.
We are just doing serious damage to those folks in rural community. Not only do they not have a hospital, but they are losing those good paying jobs in those rural communities. And I know when Jamestown Hospital closed, that was 150 jobs that were lost in good paying jobs. And you can't replace those jobs easily in Fentress County.
Right.
And so it's just devastating our rural communities.
And we have in the country, we have 34 states who have currently signed up and using Medicaid expansion and have put it to good use. Their constituents are much happier and they feel much more secure. The opioid problem that we have, they were able to immediately start using their Medicaid expansion money to help with mental health issues and drug addiction issues, whereas we're one of 14 states that has not taken the Medicaid expansion. There are 3 other states that have approved it, but they're still having some political battles over it. But we're really, if anything, right now, we need to insure more people in Tennessee.
Absolutely. And you brought up the opioid issue, and I think it's really important. There was an Ohio study done because Ohio's Republican governor did expand Medicaid initially. And what they found after their first 4 years, their study, was that they drastically reduced their uninsured rate. Most of the people in Ohio who want and need insurance are able to get on through Medicaid expansion. What they found in Ohio is they are able to treat 96% of those with opioid issues through Medicaid expansion.
Right.
In Tennessee, we're only treating 11%. Could you imagine the changes we could make if we could treat 96% of our folks who are having issues with opioids? I mean, it's just a game changer. Keeping our rural hospitals open, ensuring those 300,000 Tennesseans.
And as far as this money that we get from the federal government, the Medicaid money, if we expand it, the match is a 90-10 match.
Right. Right.
Which is just phenomenal. And for those naysayers who say, oh, we're afraid the federal government's going to back out, it hadn't been the federal government that's backed out of matching grants and stuff. So
that's right.
I don't understand. I was born and raised here. I'm proud to be a Tennessean, but I'm shaking my head about our health care and our education. But that's another story.
Well, I mean, that's true, because I talk to people every day on both sides of the aisle, and now we know that Tennesseans favor Medicaid expansion by 66% regardless of party. And so it seems like a no-brainer. When I talk to folks on the other side of the aisle, they're just like, I don't get it. It's a no-brainer. And it's purely political posturing. And we're forgetting our citizens because they don't like the politics behind it. But the reality is, those are Tennessee tax dollars coming back to Tennessee. Right now, we're just letting it sit there, and it's going to go to other states. Right. So now what we're here to talk about a little bit is that block grant proposal. Governor Lee and the supermajority in the legislature have voted to ask for a waiver to have block grants in Tennessee. And that would take TennCare and make it a block grant situation. And what a block grant is a set amount of funding that doesn't change. So once you spend that money that year that you're allotted, you're done. And I talked to someone the other day who at one point they had their children's health block granted, and they had a particular year where a lot of kids were sick and needed a lot of care. They ran out of those funds in October. So from October to December, there were no funds for children's care. And in Tennessee, 50% of our rural kids are on TennCare and rely on those funds.
Right. Well, I don't understand it either. One of the big things that worries me is that with Medicaid and Medicaid expansion, we have a very healthy oversight system that makes sure that we're trying to get health care to everybody equally, that there are no disparities in how it's handed out. And in the block grant, the states are on their own to put it together how they feel. If they decide they want to start a program over here for a special population, and they do that so it shrinks their money, they can pull it away from over here. And the federal government wouldn't allow that, and I think it's unfair to do it that way.
Right. I agree. And one of the things that we're in a situation where pre-existing conditions are so critical. It's critical that we cover them because a third to more than a third of Tennesseans have pre-existing conditions. And so basically, if you're a woman, you have a pre-existing condition. But the thing about it is, they could take away those protections for pre-existing conditions. And it's funny because you'll hear them say in Nashville, and I've even heard the governor say, oh no, we're going to protect pre-existing conditions. How can you trust that when our state signed on to the federal legislation to do away with protections for pre-existing conditions? Right. Tennessee is part of the lawsuit to take away protections for those with pre-existing conditions. So why should we trust? They say they're going to protect them, but we're involved in a lawsuit not to, by choice. We chose to be in that lawsuit.
And, time-wise, you could become part of the Medicaid expansion and notify CMS, make the necessary arrangements, and in 3 or 4 months, you'd have 300,000 more people ready to sign up for health insurance.
Right.
Whereas the block grant, has not only got to be approved by CMS, which is the federal arm, which has to approve it, and since this is a first-time request to use Medicaid money in this form, it's going to take some time for them to debate about it among themselves. And if they approve it, it's then going to go to court for the same reasons.
Exactly. That's probably the first and most important thing for folks out there to know. Block grants for Medicaid dollars are illegal.
Yeah.
I mean, currently, Frank Pallone, who's a congressman over he's chair of the Commerce Committee, has sent a letter and said block granting Medicaid is illegal. That as soon as somebody offers a waiver to block grant Medicaid, it will be in court.
Mm-hmm.
And I don't think there's a lawyer in the country that I've heard that's not said it's illegal. So Congress would literally have to change the law on how Medicaid dollars can be spent before this could happen. And, that's my frustration. They're giving the appearance like they're trying to work on a program. And if people remember in 2016, when they didn't want to expand Medicaid, but they put together a TriStar group to go across this. They did the same thing. They went across the state and they listened to people and they thought they came up with this idea to start to accept Medicaid dollars for mental health and for veterans. Because currently there are about 25,000 veterans who also need care that block grants won't cover and Medicaid expansion will. But they said they were going to cover mental health and veterans. But it's also, that's illegal too.
Right.
And they went all around the state talking about that in 2016, but the day after the election, you never heard about it again.
Right.
And I feel like this is another game to play as we're going into 2020 to look like you're doing something about health care. But it's illegal.
That's true. And the country as a whole, and like you say in Tennessee, the majority, no matter what your political affiliation, has been in favor of getting health insurance to everybody possible.
Yeah.
And that included Medicaid expansion, closing the gap. So it just looks like people are trying to figure out some way to take more time away from insuring people. And I don't understand it. Tennessee has got a lot of good folks. I do not understand. Health insurance is just, it's the Christian thing to do.
Yes.
And I don't understand. I don't understand it. We have a way to get on it in 3 or 4 months instead of going through something this complicated. And when the election occurs in 2020, there may be a new administration in there, and so then there'll be all that complication. We could sign on to Medicaid expansion, and people could start. 300,000 people could start getting insurance.
Right. I mean,
we get $1.2 billion from the federal government every year.
Yeah, and I think that was a good point that you made, that we could do this today until they get, let's start this today because we can.
Yeah.
And then later down the road, when block grants, if and when block grants get approved, if you want to try that, try it. But what we're seeing in every single state is just massive improvement. Mm-hmm. And in Tennessee, our hospital association has agreed to pay that extra percentage. Mm-hmm. And I think they're still on board with that. I think that's something that could still be worked out. And so, the frustrating thing to me is that money is sitting there and people are dying.
Right.
I mean, they are dying. There was an estimate that just came out, a study that was done in the states that have not expanded Medicaid. 15,000 people have died from 2014 to 2017 that they know of with a lack of insurance. Many of those are our friends and neighbors. I know I have friends in that group that are those statistics, and it's really sad, and we can do better. The other thing to talk about with block grants, aside from the initial biggie that it's illegal, is that there is no commitment in that proposal to insure a single additional person. It is not going to expand the folks that have coverage. And like Todd said, they may choose to make a decision on who they're going to cover and who they're not going to cover. But I don't really think, I think in order for it to be equitable, like you say, we need to use those federal guidelines that make sure that we are being equitable in our coverage of folks.
Somebody, I think, used the example of dental care as part of being health insurance, and the rationale behind the block grant would be, well, that's the only way we can offer dental care, and they were talking about pregnant women and children. The only way we can offer it to a defined population without offering it to everybody is to do a block grant.
Right.
Well, Tennessee is like one of 3 states in the country that does not offer a dental plan to everybody.
Right.
So it seems like we're always trying to figure out a way not to insure people.
Well, exactly. And someone pointed this out in one of the open comment meetings, that it's very specifically outlined on how you can get kicked off, but there's no outline for how you can get on to this insurance, or how that they can add people.
Right.
And so that's, to me, that's a little bit of a tell on what you're really trying to do, because our governor keeps talking about being able to maybe save money. And the reality is, there was an attorney that commented, and he was talking about as these, the baby boom, seniors retire, and it's going to just be more and more of a load, and we're not going to get any more money. And it's going to become impossible. The only thing you're going to be able to do are either cut services or cut people off the rolls.
Right.
And there's really no question. And in addition, we've got the Katie Beckett waiver now, and that's like some. It's so good that we passed that legislation, but I'm terrified it's going to cut into the benefits. We know for a fact that when cuts come, it's going to be those severely disabled folks who are going to be losing services. Mm-hmm. And those families just have to have those services. What we know is it's going to hit the disabled, and it's going to hit those in nursing homes the worst. I think 60% of Tennessee nursing home folks are funded by Medicaid. Right. And we know that 50% of our rural kids are, and a large portion of the services for disabled will be in there. So if you're talking about savings, those savings are going to come out of either it's going to mean cutting people off or cutting the services that you offer.
Right. I don't understand. I don't understand it. Sign on to Medicaid now, and in 3 or 4 months, you've got people insured, shopping around for insurance. If the people who believe in the block grant, then they can pursue that and nail down some of the specifics that they think show that it's something better. In the meantime, we will have insured at least 300,000 more people. There'll be, right now, I saw a figure where we're up to 5% of the children in Tennessee are uninsured, which is a pretty big jump. Tennessee used to have that percentage down pretty low, and so 5% is not a good.
And that was another mistake of the states in getting the packets out to families to re-up their insurance. Many of the families didn't get their packets, and over 100,000 children did not get back on TennCare. And Governor Lee says we had a $1 billion savings. Well, cutting off 100,000 to 200,000 kids is not a savings. No. That's children in our state not being able to go to the doctor when they were sick. And what they found out, a lot of them go to the doctor thinking they're insured. They didn't receive a packet. Right. And they get there and they find out they have no insurance. Right. And they're in a real fix.
Well, and another argument that I saw for block grants had to do with the ability for the states to deal with their individual situations and get their health care more efficient. Well, the positive thing about TennCare in Tennessee, our Medicaid, is the federal government agrees we've just about made it as efficient as it can be. It's well done. Now we've had a horrible experience with trying to go online with applications and whatnot. That's not the people giving out health care at TennCare. That was the administration who hired whoever, and I guess we're still paying for that. But it just makes sense, to stay with TennCare. As far as efficiency is concerned, we just need to expand it. There's no reason not to insure the rest of Tennessee.
Well, and a big reality of part of the problem of why those children did not get their packets, they didn't do it out of Tennessee. They farmed that out to a private company in California. And we don't know, did they send the packets to the wrong addresses? Did they send the packets at all? But why aren't we taking care of those? Let's take care of the things we can take care of in house. But by them shopping that out, all of those kids lost care. Something else that the block grants will not touch are the rural hospital closures. It's not going to change anything on that reimbursement money that comes in when we expand Medicaid. And so we are not going to have more insured people. So there aren't those hospitals, those rural hospitals are not going to be getting that reimbursement because so much of their care is unimbursed. They're not folks not able to pay. And if they're not going to get that reimbursement money, they're not going to be able to stay open. And block grants won't stop our hospitals from closing.
That was always envisioned by the Affordable Care Act. I mean, there's some things that need to be tweaked in the Affordable Care Act, like every major legislation that's gone through the federal government. So you do that. But that was one of the main items, is that they recognized the importance of having small and big hospitals spread out all over the area, not just in the big cities.
Right.
So that everybody could take advantage of that. So a mother having a child didn't have to travel an hour to get to the emergency room, if there was a complication.
Yeah. I just heard from a friend the other day that a child needed to get to the hospital, and everything was complicated there was a child in Fentress County. Everything was complicated by the fact that hospital was no longer there, and they had to go further away.
Right.
And there was also a woman a senior who had a stroke, had the same situation.
And I guess trying to be clear about that with the Medicaid expansion with the Affordable Care Act is that those hospitals will be there. They will be employing people in that community with good wages. That was all part of it. The hospitals then are able to continue to treat when there's no payment, but there is a payment because it comes from the Affordable Care Act.
Right.
And that's what we're not taking advantage of while 34 other states are.
Yeah.
And it's time for us to just sort of admit that it's something worth trying, even if we want to pursue the block grant like you said. Let them go ahead and get the kinks out and try to get it, but let's go ahead with the Medicaid expansion.
Okay. So I'm going to give you guys a little brief rundown of what Medicaid expansion does and the kind of a comparison with Medicaid expansion and block grants. But Medicaid expansion will provide insurance for the 300,000 folks who need it, including 25,000 veterans. It will keep our rural hospitals open. It will include mental health care to take care of folks with those mental health issues, and it will also be able to make sure we're able to treat all of our folks with opiate addictions. And we didn't even talk about the fact that it'll create 15,000 new jobs in Tennessee, and those are good paying jobs.
And the veterans?
Right.
Yeah, the veterans that don't have insurance
will have it with Medicaid expansion.
Yeah.
So then with the block grants, first of all, it's illegal. Secondly, it does not commit to add a single person to the rolls. It doesn't cover our rural hospital closures. It will not address our opiate issues. And the biggest cuts and the first cuts are going to come to the disabled and those Tennesseans who are in nursing homes. So here's what you can do, though. There is something you can do. Up until October 18th, you can make comments, and your comments will be heard. They've done a tour and gone around to some cities and had people be able to give their comments personally. But you can submit comments either by letter or by email. You can submit your comments by letter to Mr. Gabe Roberts, Director, Division of TennCare, at 310 Great Circle Road, Nashville, Tennessee, 37243. Probably the easier route, if you use computers, you can email your comments to public.notice.tencare@tn.gov, and it's at the bottom of your screen after the @DTV Knox 1. That email address is public.notice.tencare@tn.gov. And you have until October 18th to make those comments. I would say that if you didn't get the address and you want to get that address, you could probably call the Knox County Democratic Party, and they could give you that address as well if you wanted to make your comments by mail. But you'll need to do that pretty quickly because it's actually next Friday that is the deadline for that.
And there was a public hearing here, and there was a lot of 70 people showed up.
Yes, yes.
And many people spoke, and they were mothers, they were older folks, veterans. So there's a lot of unrest about this particular direction.
Oh,
especially
yeah.
when we have an alternative.
Yeah, I saw you at the Knoxville meeting, and every single person there spoke against the block grants.
Right.
The day before, I had been in the Nashville meeting, and there were probably close to between 150 and 200 people there. Also, everyone spoke against block grants. And Knoxville, it was great to see the folks that are from Upper East, the Little Lobbyists.
Yeah.
I don't know if you guys follow the Little Lobbyist on Twitter, but it's moms who have really involved multiply handicapped children that need a lot of care, that are covered under the Katie Beckett waiver, which we passed this year. I'm so excited that we passed it, but I'm also a little embarrassed that we were the very last state to do it, because these really medically involved kids they're so wonderful, and even they just deserve the families deserve that extra help that they need. And it's so difficult to raise a child with so many of those issues. And I think that all the help that we can give them, is critical. And I was glad that the entire legislature this year passed that bill.
Healthcare definitely should be a right in this country.
I agree.
There's nothing but benefits that come from that, beside the fact that you're doing the right thing.
Yeah.
So we have just.
And I probably should mention also the Michigan study. Michigan was another Republican governor who initially expanded. Their study looked more at how did it affect low-income working folks to have Medicaid expansion. Right. And what they found was a huge influx of people back into the workforce because they got healthy. And they found that it decreased the debt of those working poor and those folks. They were able to get car loans and things like that. But what Michigan noticed was it was a huge boost to their economy.
Right.
To get those people back to work, to get them healthier, to get them getting better jobs because they could get a car to get transportation. And so what Michigan found is that 10% that the federal government doesn't pay, they said we can pay that forever. Right. It's going to be easy because of the increase in productivity because of these healthy folks in our state. And why, I always go back to, we talk about the greatness of America and the strength of America, and we are only strong if all of our citizens are strong.
That's true.
And that means that all of our citizens need to be healthy.
And it has to be so that there are not many people in Tennessee that do not know someone that is struggling seriously because of health care needs they have but they can't meet, and the sacrifices that the whole family has to make.
No, that's exactly right. And as I said, a friend of mine fairly recently died of cancer without care. We can prevent this, you all. Please make your comments heard to tn.gov. And thank you so much for tuning in, and we will see you next week on DTV.